And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction, how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey. Welcome to another episode of Keeping It 100. I am your host, Dr. Kristin Motley. And as always, we have an amazing show in store for you. Please give yourself a shout out, pop us in the chat. We will make sure your questions get answered. We will respond to your comments. Just let us know y'all are here and y'all are watching. Let me bring in my super talented, amazing co-host, Georgie Mink Jr., the street practitioner himself.
Hey. What's going on, Doc?
Yo, you been street practicing?
Oh, man. It's busy out here. Yeah, I've been getting it on, Doc.
That's good. What the streets saying these days? What they say?
Brothers still being stubborn. I mean, but I'm working on them because I was one of them stubborn brothers. So, yeah. Sisters, too.
You wearing them down. I mean, right now we're really trying to, let people know, tell your parents, your aunts, your uncles, your grandparents, people 65 and older, letting them know that a new recommendation came out to get another bivalent vaccine. So that's the message. So right now we can take it easy on the non-responders so far, but we're going to come for them. If a new vaccine is available in the fall, we're going to make sure they're good. Because a lot of people had COVID. So if you had COVID already, you have some protection depending on how long ago you had it. Hopefully, we can get through the summer without any spikes.
Right.
Hopefully we can do that. I forgot to tell you last week. So I went to the dentist. I've been going to the dentist every 6 months since I had my first tooth. My mom just did not play. Like, we went to the dentist every 6 months. So I still go as an adult. Right. So every 6 months I go to the dentist and everything is all good. This time she was like, well, here are your teeth from 2020 and this is 2021. And I'm like, okay, she trying to tell a story, but let's get there. 2022 and today. And she was like, you see this right here? You have a cavity.
Oh.
I had to clutch my pearls. I was like, cavity? I have a cavity? Are you kidding me? I was so devastated. So 42 years old and my first cavity, and Bilal was cracking up. He was like, see, there you go. Like, you thought you was exempt from having a cavity. You thought you was better than everybody else because you ain't never had no cavity. And I don't do nothing special. I mean, I brush my teeth every day, but I don't hardly floss and blah, blah, blah. So I must just have some kind of teeth that just haven't been prone to cavity. So I was very devastated and I had all these questions. I just needed to know what and why and how. So
wow,
I agreed to come back for my appointment. I don't know, I might cancel it because I'm really scared to get a needle in my mouth. But I agreed to go back. And she had tried to make my appointment on June 19th. I was like, that's Juneteenth. I can't come on that day. First of all, I don't even know why y'all open on June 19th. I don't even know why you offered me that spot.
Right.
But no, I will not be here on Juneteenth. Thank you.
No, not that day.
No. So I was like, I don't know if I got microaggressed or what, but I just really I was, just really trying to figure out why they would offer me such a date for me to have a cavity. And I was already in shock. But have you ever had cavity before?
Oh yeah. So it's common. It was common with me, but I'm surprised with you, Doc, because you watch what you eat. You just. So that's why me and Bilal could joke.
Your turn.
And I wish we had video of that doctor telling you you had a cavity.
I had lost all, I went completely flush. I just could not believe that she was showing me that I had a cavity. And I was like, are you sure that's what that is? Are you sure? So does it hurt to get a feeling? How's it feel?
I mean, back I would think nowadays I would say probably not. Like, I mean, medicine and like the theories and like everything just changed. Just everything, the way everything is done. I'm not sure. We'll probably have to ask Kristin. I'm not sure. He's a little younger than us, so I don't know.
Kristin in the background minding her business. Right, why you gonna throw her in this?
But I want to be with you though, Doc. You know, you got my prayers.
Thank you. Yeah. My heart racing just thinking about it. Oh, all right. So y'all know June is Men's Health Month. So every show this month we are bringing important information to our men because Black men's health matter. Mm-hmm. So today we have a really good show in store for you. Let's bring in Dr. McCrea. We're going to see what his cavity game is. But before we check on cavities, let me introduce him real quick. Dr. Leroy McCrea is a Senior Associate Dean of Diversity, Equity, and Inclusion at Drexel University College of Medicine. He is an Associate Professor in the Department of Family, Community, and Preventative Medicine and former Program Director of the Drexel Tower Health Family Medicine Residency. His academic interests include curriculum development, leadership training, workforce diversity, mentorship, and competency-based evaluation. His clinical interests includes men's health, which is why he's here today, women's health, adolescent medicine, contraception, and office-based procedures. And we found out that he used to work at Crozier. He trained at Crozier. He worked there for many years, and he was the physician for the athletes at the high. So he got some Chester High.
See pride in, yeah.
Little orange and black over there, little orange and black. Welcome to the show.
Thank you. Definitely remember those days trying to help get those school physicals done so that the athletes could get out there and do their thing. Nothing worse than being held back from being able to display your athletic talents than, needing to get that clearance. But the clearance is important. Mm-hmm. Because, there are sometimes a few hidden things that can happen inside the body we want to make sure we take care of. So it's a great chance as a doc to be able to, interact with those young athletes, especially those young males, to talk about health concerns that adolescents would have. So it's really valuable.
Nice.
That's great. So we appreciate you for doing that for our young athletes and making sure that they're good. And I'm sure they were glad to see you. And so I'm sure that made a big difference as well in terms of the conversations. And so thank you for your service to the Chester community.
Absolutely.
We appreciate it. On behalf of the citizens of Chester, we say thank you.
Listen. And as a native Philadelphian, we can have enough of love for y'all out here in Chester. Y'all just right down the road.
Yeah.
Cousins. Philly and Chester, they cousins. They're first cousins.
So our dads are brothers. Our dads. Have you ever had a cavity? I mean, I don't mean to put your business.
No, you can definitely put business on the street. So yes, I have had a cavity. And cavities are irritating. And what's funny? There's this whole theory about how your mouth starts to fall apart once you get past a certain age.
That's what my
and so I think I heard you allude to how old you were and that you have cracked 42. The 40 threshold. Oh yeah, your mouth's about to fall apart a little bit.
That's what she said. She said all her sisters.
So the flossing's got to get ferocious. You need to get that water pick.
Yeah, that's what they
start getting that stuff from in between those teeth. Especially, listen, you brush your teeth in the morning to make sure your breath is fresh. You brush your teeth at night to make sure to keep everything away. Right? You know what I mean? People really focus on the fresh breath during the day, but you got to knock that sucker out before you go to bed to get all the stuff out from the bed.
All right, I got to change my routine. Carve out some time for my oral hygiene.
Mm-hmm.
But you've been going every 6 months, which is really respectable.
My mom had us do it. I mean, I've been going like that my whole life. So it's just a part of what I always did.
No, that's great.
Wow.
So that's good. Thanks, Mom.
Yeah. Shout out to moms.
So wait a minute. The dentist said that my cavity was really, really little. And I was talking to another friend about it. And she was like, man, you could just wait till next year.
Okay, so that's a mistake. Mm-hmm. That's that's like you saying, you know what? Like I got this small water leak at my crib.
Right.
What I'm gonna do is I'm just gonna sit on it until it gets worse. Like,
so next year, right? I'm gonna just wait.
Hey, like, what we doing?
It's so little, and it take like 2 seconds for them to fill it. It's not even like a big deal.
Then let them fill it. Fill the crack so the crack doesn't get worse.
Right.
right? Because all the crack is going to do is get worse. It's not going to get better. Come on, Dr. Motley. Look, look. I know, right? Look at the doctor over there getting all anxious about going in there.
Too hard on the world, though. But when it comes back, oh, man.
Listen, and listen, here's the thing, though. They have really good stuff now, right? So depending on the provider you go to, they have stuff now that can actually numb the area before you even get the injection that's going to numb it. Right. You get a little pre-numb situation, and depending on how shallow it is, sometimes you don't even necessarily need a bunch of numbing medicine in order to actually fill the cavity. So,
okay,
I think you'll be just fine.
I might keep my June 21st appointment.
Yeah, I know, because I heard you wasn't feeling Juneteenth.
Not at all.
Why would you say that to me? Like, seriously?
How I mean, cultural sensitivity is what it is.
That's true. I know that's your area. I might send you over there to do some training.
Well, but here's what I think I'm gonna say though. I always believe this. I believe people just need to have choice. Right? I'm a doctor, right? So if I didn't work on holidays, then people wouldn't be well. Right? That's like, true. When I round in the hospital, I work on Christmas, I work on New Year's, I've worked every holiday.
Right.
Yeah.
So, right, you know what I mean? So like for some people, that day off is the only day they have a chance to get to go to the dentist.
That's a good point.
Right. So I think that we just need the balance.
That's a good point.
Right. That's all I'll say. So before we kill them completely,
I appreciate that.
I appreciate you just got to think about, those priorities for each individual.
Wow, Doc.
Note to the world: don't offer me nothing on Juneteenth.
She heard you, but she heard you.
No.
That's true. Because I remember working in the pharmacy. Like, we didn't have off for the holidays. We wasn't there, so I get that. But I just didn't appreciate it in that moment. I was already in shock.
Well, no, listen. You was already sensitive, and when you already a little bit hurt.
Yeah.
Then that little bit of added stuff on top, man, that makes it a real challenge.
Oh, yeah.
That was the icing on the cake.
Wow.
But we wanted to bring you on today. June is Men's Health Month, and we wanted just to bring awareness to men and get them really interested in taking care of their health. We know it's really important. We know that Black men often see the worst of the health disparities in many health conditions, especially preventable health conditions.
Absolutely.
And so we want to have these conversations so that we can, level the playing field and look at the charts, become more level, and not always be off the chart all the time. I'm really exhausted after years and years and years, and I feel like we've made some progress, but not enough. So let's just start off by talking about the fact that, men perceive going to the doctor like as a big deal. It's a big thing. And it can cause them, to just not do anything because it's such a big deal. Can you talk about some of the barriers that men face in their reluctance to go to seek medical attention or go to the doctor?
Yeah, absolutely. So I think that the opening of your show, you said something that was very important, and a part of that is modeling. You said part of the reason why you went to the dentist was because your mama took you to the dentist, and that was part of a routine.
Mm-hmm.
And so one of the things I think we need to embrace is that for many in our communities, going to the doctor has never been routine. So going, seeking care, having regular follow-up with a primary care provider has never been a part of the thing. Annual physicals, like those are all things that for many folks, especially Black folks, especially Black men, has not been something that they regularly do. Many of us come from cultures where you only go to the doctor when it is incredibly broken, when it is hurt, feeling beyond repair, when it's at the end of some road. And so I think that one piece is that notion that we have not really routinized the concept of going to the doctor. And so I think one component of Black men is that we just have not been doing it. Another piece is that, and we talk about like all these systemic factors that happen in the world. It's hard to prioritize your health when the other key components of life have not been met.
Yeah.
Right. Like, so like, is my job secure? Is my family safe? Do we have enough food to eat? Because many men are providers for their families, right? or they have really embraced the importance of taking on that role and that responsibility. And so only when those things are well cared for do we then think it's time to turn attention to the thing, like, because if it ain't hurting, like, why am I checking on it?
Yeah.
Right. Like, it's not really an issue for me. And so I think that's a second piece, which is that notion that on the list of things that prioritize for an individual, their own well-being may just not be at the top because they have so many other concerns to deal with. I think there's a portion of men, though, that we like to ignore stuff. Let's just call it what it is. And if I don't address it, then it's like it ain't happening, right? Like, I know I'm a little tired or something ain't feeling exactly right, but I'll just rub a little Bengay on it or put some Neosporin on it, or
Tussin.
so yeah, right. Tussin for everything, right? You do all of those classic things, right? With the theory that it's just going to magically get better. And we know that putting your head in the sand is also not an answer.
Right.
And then I think the last piece is really this notion of how the health community receives you when you finally go for a visit. Is it timely? Right? Is it timely? Do you have a provider that understands your lived experience? We know the concordance between patient and provider. The idea that I have another Black man to take care of me, or at least have someone who's culturally sensitive, is going to definitely positively impact health outcomes. But if every Black man is waiting for another Black man to be their doctor, they in trouble. Yeah. Right? Ain't a lot of us. Right? Like, let's just call that what it is, right? So we need to at least have a healthcare system that creates some degree of cultural sensitivity so that when people come in, they're able to unpack some component of their lived experience and say, and have an understanding for why the diet might be why it is, or why you're not getting the sleep you're supposed to, or why you can't make it to every appointment, or why a virtual visit might be better, or, why it is that you feel weird that a doctor did or didn't put their hands on you. I got this whole thing where sometimes people feel like, man, the doctor didn't even do a complete physical exam on me today. Like, what's going on? You put your hands on me? Yeah. So there are all these things that happen. And then the other piece in that distrust is sometimes many people in our society, in our culture, have gone to the doctor and have not gotten reasonable health outcomes because they've been treated poorly by physicians. And the system has abused them. And so all those factors go into a really big pot. And at the end of that is, I can wait till next time to go to the doctor. Or again, it ain't hurting bad enough, so I'm just going to wait. And then we blame the healthcare system for saying we caused something. The healthcare system did something to you, because when you finally get there, now you got hypertension, diabetes, hyperlipidemia, and you got early prostate issues because you ain't been to the doctor for 35 years.
Yeah.
And so that seems to be where we're going.
Those are some really good points. And it makes a lot of sense. Like, all of the cumulative effects of the things that you mentioned will lead to someone not going for many years. Especially, I like the routine thing. I never even thought about that as being a component, but that makes sense. It just is not a part of the routine in a lot of people's lives for a number of reasons. We don't even have time to go into those reasons.
No,
but I do want to give the street practitioner a shout out, because he had his first physical exam recently after some time. Do you want to talk about that a little bit?
Well, I was one of those guys in the first question. And
hey, listen, real talk. I'm a doc too, and I just got myself a primary care provider within the last couple of years. Wow! So, like, you ain't alone. So tell me about your story, though, George.
And I mean, we do prioritize things, and it's taboo for a Black man just to handle business and to keep it pushing, to drag the work with one leg. That's the mindset. Yep. So, but working with the doctor and just feeling more health, educated, like, no pun intended.
Health educated.
I finally went to the doctor. I made several appointments. I never showed up. I finally went. I found out I had like a small sense of like a high blood pressure. So they put me on like a low, I think what is it called again, Doc? I forgot. Nifedipine.
Okay, yeah.
A small dosage or whatever. And I was glad I went. So talking to Bilal, shout out to Bilal, Doc's husband, he went and got his colonoscopy. and now I finally set mine up.
Okay.
But it comes from like years of just handling business, though.
Mm-hmm.
Some of it is negligence, of course, on our behalf. But if it's not broke, or if it's not obviously broke or out in the open broke, then I'm still good to get up every day. I still been going to work. But we just know it takes one day for all that to stop.
Yeah.
So that's the problem. Like with the turning wheel, we don't know when it's going to stop, and we need to we need to see it coming. So that's basically really been the story, man. Like I said, I was in the number one first question. I was that guy on the opposite end of it. But educating myself, feeling more comfortable with the health system, with the healthcare system, because that is a big thing. Like we do want to feel comfortable. Like most Black folks I know, we get scared when we go to hospitals, doctors. We always premeditate the worst. So we think we're gonna find out the worst thing ever. Oh my God, I know I haven't been eating right. I know all these things come up when you're going to the doctors. So it's just like you said, it's about habits. It's about a routine. Especially when you start hitting age marks and 40s, and everything is routine now. Like sleep is big, your diet is big, checkups are a big checklist. Regardless of you got to put that in priority mode. So, but that's pretty much my story, Doc. So now the 23rd, I will be going for my first one, and
I'm impressed. Listen, dude. Listen, I just turned 45.
Okay.
So I've got to get mine set up for this year too.
Right.
So listen, and I'm in a similar place. I tell people all the time. So I also have high blood pressure.
Okay.
I had high blood pressure now for probably 10 years or more.
Wow.
Okay. And it was important though because and I tell all my patients this: you don't have an appreciation for many of the things we do for patients till you become one. So like I take a diuretic, right? So I take lisinopril and I take hydrochlorothiazide. Those are my combo pill. I take 2 pills to control my blood pressure.
Okay.
And I used to have patients who would always tell me, "Oh, doc, like I hate that diuretic, that water pill, man, it drives me crazy." I had no appreciation. Now I take a water pill. Let me tell you something. When you take a water pill, when you got to go to the bathroom, you got to go. Like it's like it isn't like a thought and a wish and a hope. It's like, oh, what's happening?
It's no yellow light. It's
no yellow. So Dr. Motley and Georgia, to the point where I actually have to void. I go to the bathroom before I leave every location.
Wow.
Oh, wow.
So what?
If it's a toilet near you, going to the bathroom.
But what happened was I then started to appreciate when I had patients who like work 12 or 16-hour days and they not taking their medicine.
Yeah.
I wasn't asking the right questions.
Right.
And then I could have taken them from the water pill to the calcium channel blocker to nifedipine. Or if the nifedipine causes you swelling in your legs, let me tell you that. Or if the beta blocker causes you to have some stuff in the bedroom that you're not happy about, let's talk about that.
Right.
So we can get those things sorted out and we can find a medicine that'll work for you. But we got to be willing to have that dialogue and that conversation. That's why I say, again, that sensitivity to be able to create that dynamic between yourself and your provider, to be open and honest, and also to share lived experience really, helps to open that door.
Wow.
I think that's so true. And I really appreciate you sharing 2 pieces of health information with us today. Because I think it makes, a person like you more relatable. And so, just always trying to, the show is keeping it 100. And that's what we, try to do. We try to, we don't want people to feel like we're different. Like we are here struggling.
Yeah.
Just like, it's all the same. We are all trying to figure out this thing together. And I really appreciate the fact that you said, it's really hard to see it until you get in their shoes. And so as much as, I am trying to be as empathetic as I possibly can. And I know you do the same thing, but it really is different when it's you. So I was in the ER this weekend when my son has asthma, and it's a new diagnosis for him because he's only 3 years old.
Okay.
So
that's scary, mommy.
I've been, so I've been counseling patients with asthma for years.
Yeah.
But I sat in that ER like I ain't know nothing about asthma. I had all these
You
questions.
figured out she was the doctor and everything.
Listen, the doctor was trying to leave. I was like, I got more questions. And I never tell anyone that I'm a pharmacist because I don't want them to treat me any different. Like treat me like you would
Understood.
treat any
Yep.
person that come in here and make it clear and plain. But I do go in on my questions. So I had all these questions like I ain't never heard of asthma before.
Yo,
But it's different. It is
Yeah.
different when it's you or your child. It just hit different.
Mhm. I have one more similar story about that, which
Mhm.
is, you know, I'm a family doc, so I take care of everything from the womb to the tomb. We used to deliver babies, whole 9 yards, right?
Oh, wow.
nice.
And when I used to take care of kids, I used to always, you know, especially really young kids, I used to be like, oh, you know, just give them a little more water. You don't need no medicine for constipation, right? Because you ever had one of your babies like really be constipated? You know, the parents would come in and I'd be like, oh, it's not that big a deal. Just drink a little bit of apple juice. We're not gonna give no medicine. Let me tell you something. The first time you see your own child, shed a tear
Oh.
as poop is attempting to come out their bottom,
Right.
you be like, how many medicines do you need? Right? Like, give them all.
Right.
Give them all. Whatever. Right? Because you don't appreciate it. Or they get that little fissure down. Like
Yeah.
you just have to be able to like have some component of lived experience. And then the other thing you start to say to yourself is that people aren't stupid. So people are not inherently stupid, and they are not. Why are they making decisions that we don't necessarily think are logical? There has to be some other rationale
Yes.
for why it is that otherwise intelligent people,
Yes.
again, Americans, our communities, these are not stupid people. These are people who are living it every day, doing their stuff. If they're making a decision that doesn't make sense to us, there has to be a why. And so
I agree with that. And I think I came to that realization with COVID and dealing with the vaccine hesitancy and listening to reasons that people from our community didn't want to get vaccinated. It made sense. Why should they trust the government? What if you look at housing, you look at like education, you look at food insecurity, like all the things that the government does, criminal justice. Like, why would I trust you now? And you have failed me in all these other areas.
Right.
Like
Right.
it makes sense.
Totally.
I know why you don't want to get vaccinated. So it helped me to frame the conversation in a way that could give them information, but not me say you're wrong for how you feel, because you're not wrong for how you feel.
Right.
And you know, the other hard part about COVID, and I don't want to jump on COVID necessarily, but I do like talking about COVID, is we overpromised. You know, people were getting vaccinated and still getting COVID.
Yeah.
And so when we overpromised in the beginning, and cats that I knew were like, my man got COVID anyway. So why am I going to get a vaccine that can cause me side effects and craziness and still get COVID? We didn't really do a good job of really helping the community understand decreasing disease burden versus true disease prevention. Right? You know what I mean? And so like we really didn't own that narrative. And so it made us come off as really disingenuous. And so, you know, and so it like I feel you on that. And right. And people have a right to decide. It was hard though. I mean, you know, being in the hospital and seeing people who otherwise should not, who otherwise today should be living, who are not because of that virus. It gives me a really difficult place in my soul because I feel like some of those people could be here if not for the vaccine.
Right.
And I wish we had just done a better job really explaining to people just what it all meant, how we got the vaccine so quickly. You know, listen, I don't really do social media, but the one time I made a social media post was me getting my vaccine. You know, I got it like really, you know, I'm a healthcare provider, right? So I got my vaccine pretty early in the process the first time. I remember my friends being like, you ain't never on social media. What is this? And I was like, this is just that important to me. But I think that like, you know, continuing, and this is a part of the same thread about how men don't engage with the healthcare system. It's about us treating people like people. It's about us giving them information. And then it's also about giving people autonomy, right? Like you and I, Georgia, as men, we had to come to the decision that we were going to prioritize our health.
Right.
Like no one can make that decision for us.
Right.
But as long as we have people who are ready to receive us and we're ready to engage the system, then we have an opportunity for success. Like, I hope that you are creating good partnership with your provider.
Right.
And that you all are starting to bond, not just over, hypertension management, but also on like life management.
Right.
And so that's what you really want out of that longitudinal experience.
Right. And that's actually important for us, like for our people, like as a whole. We want to feel comfortable.
Yep.
Like that's a big part of it. Like the whole process, even with Doc going through the asthma deal with her son, like the main thing is being felt comfortable. We need that comfortability so we can like start zooming in to the proper direction. Because if I'm not comfortable and I'm still uncomfortable, you can say whatever you want, and you're gonna feel like what the Charlie Brown teacher. Like that's what it's gonna sound like.
You got it.
I could be hanging, my arm could be hanging. I should be like, you know what, I'm okay. I got a segment tomorrow with Doc anyway. We got Juneteenth events coming up.
Yeah.
She'll play with Juneteenth. I'm gonna make sure I'm there.
Right.
But yeah, you're right though. That's a big thing, man. I mean, and I'm gonna start preaching that when I start talking to brothers and sisters out there. Like, that's important. Like, do your homework though. You're allowed to look the doctors up. You're allowed to look at their history. You don't just have to pick a physician through a provider. You can actually look and do your homework on the doctors. We got to start doing these type of things to feel more comfortable.
Yeah, absolutely.
That's the truth. Now, just switching gears a little bit to mental health. What are some reasons that you would advocate for men paying attention to their mental health? George said that the Black man got to be strong, got to stay with it, got to keep going. But I know the weight of the world is heavy on the Black man. And so what are some reasons that people should like really be paying attention to their mental health?
Yeah, I mean, I think that for a few reasons. One, I think that historically mental health is something that the Black community has not done a really good job with. And especially in some part because we are people of faith.
Right.
The Black church, and many other faiths. And I am Christian, so I'm speaking about a known in that. But I know that other faiths, of which African Americans also predominantly, have similar tenets around the idea that you can pray this away. And if you get on your knees enough, that God is going to answer all those prayers, and God will.
Yes.
But one of his gifts to you is healthcare providers.
Wow.
Right.
Right.
You know what I mean? If you guys ever heard about the parable about the person that died at sea?
No.
So it's this real quick parable, right? So a guy is stranded at sea, and he prays to God and says, God, please send me a sign. Please help me. Like, I am out here. I'm about to drown. And so a person comes up in a rowboat and says, will you come on in? I'll take you away. And the guy says, no, I'm waiting for a sign of God. Somebody else comes by with a big yacht and says, hey, you should come on in. He says, no, I'm waiting on something from God. And then the next person comes by and just throws him a life raft, says, you should be able to float. He says, no, I'm waiting for a sign from God. And then the guy finally drowns. And he says, God, I was waiting on you. He says, look, I sent you a life raft. I sent you a boat, a guy rowing. I sent you a yacht. I sent you a life preserver. Like, what more was I supposed to do? Wow. And so that general premise is that part of answering the call is that God is not only providing you with what you need spiritually, but also putting tools in place for us to help you exist in this space here. And so I think about that when I think about our approach to mental health. Our toxic Black masculinity. Are men allowed to cry? Are we willing to show, actual overt love to one another? Those are really difficult things. When I think about, again, I talk about those principal things about, the actual hierarchy of needs. Do you have safety? Do you have shelter? Do you have food? It is hard to deal with if any of those are actually compromised, you being in a good state. How can you not be depressed? How can you not be anxious? Let's talk about this pandemic. How has this pandemic affected our ability to just be in community with one another? right? How has it affected our ability to be able to actually feel safe? How about our willingness or lack thereof now to go back to work? How many of us want to work from home now?
Everybody
What?
that proved that they can.
Hello, everybody's like, I don't even want to be around humans no more. But
Right.
we are not thinking about the negative consequences of lack of actual human interaction.
Yeah.
Right? Like there's something about just being able to bump into a colleague and talk about what happened over the weekend. Like y'all are chopping it up here on this podcast because y'all are in community with each other.
Right.
And I suspect that y'all community didn't just start on screen. Maybe it did. And if it did, then, you know, my theory's out the window. But the point is, my point is, though, you have an ability to still connect. And so when I jump back and I think about, so what's happening with our men in health, even more taboo than like going to get your blood pressure checked is the idea of having a therapist.
Yeah.
Wow.
Or starting heaven forbid, an antidepressant.
Right.
Right. So if I got a therapist, that means I got to be willing to tell somebody my secrets. I mean, who do we tell our secrets to? Nobody, or you got some homie that knows all your stuff.
Yeah.
Right? A sister or whatever. You got one person that you dump it all on who may not be equipped to help you unpack all those things appropriately. You got childhood trauma you've been dealing with. You got all these things that have been going on. And again, we're trying to live up to a vision, a dream, or an ideal. Also, part of that depression, part of that anxiety, part of those frustrations and just part of that like melancholy that a lot of us feel is also because of our own perceptions of success. Think about what it is. We talked about, Georgie, about our want to keep driving, keep pushing, keep whatever. You know, I don't own my house yet. I'm still renting. I'm still living with my mama. I'm still, you know,
my credit
ain't right. You know, my significant other is this, or I'm attracted to somebody I'm not supposed to be attracted to because the world's not ready for that.
Right.
I mean, are all these things that happen all wrapped up in what it is to be a Black man. And so we don't give space or room for us to unpack that. And if you think there's a paucity of Black male physicians, don't even get me into Black male health professionals.
Wow.
That's a whole nother level of scarcity. And so a willingness to be able to go and unpack and have somebody hear your experience and help you manage those things is crazy. And then the other part we talked about again is the medicine, right? There are people who have clinical depression, anxiety disorders, panic, bipolar, schizophrenia. Those are things that require actual treatment. Half of the people who are dealing with substance use disorders are really just undiagnosed mental health disorders, and they have learned to self-medicate because the world has not created a space for them to be able to deal with their actual underlying issue. And so they're so critical because I do believe that, especially for the Black community, the presence of Black males is essential in whatever that capacity is. Our ability to love our community, our ability to be heads or co-heads of households and understand what it means to be a head of household. Head of household don't mean you make the most money, you make the least money, but just an ability to be part of the shared decision-making of what happens, to have us folks be pillars in our community so that these young Black boys can have something to aspire to that is close to them. Instead of aspiring to be things that like are complete distractors. Like those are really, really, really important things, but we can't do that if we don't take care of both our physical being and our mental being.
You broke it down. You definitely broke it down.
That's
a lot to unpack right there for sure.
Wow.
I also wanted to ask. So I wanted to ask you about menopause. G, what do you want to ask about that?
Hit me up.
Yeah. I mean, we know it's common with women.
Yeah.
I just want to know, is it like a similar stage or transition that men can experience in the terms of like hormonal changes?
Yeah,
and basically it's and that impact on their health.
Yeah, so it's a fantastic question. So women have a very discrete menopausal zone where there's a clear transition. Ovaries don't do what they used to do, and an ability to procreate has ceased. Men don't really have what we call a cliff that necessarily fall off, but for many men, for example, they peak in terms of testosterone in their early 20s.
Okay.
And then there is actually a gradual decline in their internal testosterone levels, so their primary hormone levels over years.
Mm.
And that gradual decline often sometimes comes to a point where, let's say as a random number, let's say you had, 2,000 units of testosterone when you were 20.
Mhm.
And then by the time you're 45, maybe it's 1,000. Well, 1,000 is still plenty for you to do your thing.
Mhm.
But maybe by the time you get to, 62, maybe it's like 500.
Mm.
And now you're not running as fast. The muscle mass isn't as good. It's a little more of a challenge for you to have intimacy.
Mhm.
And so those things happen over time. So we don't necessarily have as precipitous a cliff, but the difference is that each person starts out with a different basal high-end testosterone level. So George, you might be somebody who has 5,000.
Mhm.
Maybe I'm born with 2,000.
Right.
And our rate of decline may be different. So as a result, I might exhibit symptoms in my 40s, and you might not have his symptoms until you 85. You're like, George is like, man, I'm virile and I'm strong. I don't know what you're talking
Right.
about, Dr. McCrea. I got this going. Meanwhile, I'm 37 and I'm having issues. Each person's different. And so that's another reason to have a conversation with your provider. But there are things you can do to help manage that. Exercise,
Mhm.
weight management. Because as we increase our body mass index, we find that those levels of testosterone internally for men start to decrease. Control your blood pressure. Control your cholesterol, because those things actually affect not only your heart, but they also affect things in and around your brain. They affect your metabolism. They affect your energy level. And those are all things that do. And then always maintain a balanced diet, because the balance in that diet actually helps to make sure you keep your energy levels up.
So in terms of the testosterone levels, is that something that men should get checked, or do you only check it if it's something wrong?
Not necessarily routinely. And the hard part is because I don't know where you start.
Yeah.
No one's checking testosterone levels on 21-year-old because there's no reason to. We don't do any tests on people. We do just because.
Mm-hmm.
And then I often say to people, we need to figure out what your goals are at every phase of health. I'm 45 now. I don't need to be the same Leon I was when I was 21. I'm okay with that.
We don't want 21 Leon.
Nah, right? Like, I'm good.
Right.
Right? You know what I mean? Like, I just want to be a happy 45-year-old Leon with all the things a 45-year-old does. I want to be good with that. Yeah. I don't want to be an 87-year-old Leon at 45, but I'm very comfortable being a 45-year-old Leon. And so you go over what those goals are. So again, what are your exercise tolerance goals? What are your goals related to intimacy? What are the reasons that things are going well or not? A lot of times, and usually this comes up, with respect to intimacy for men, right? Their libido, their ability to get things going. But oftentimes when I peel it back a layer, it actually has nothing to do with their equipment.
Right.
It usually has to do something with their interpersonal relationship with whomever they're attracted to. Or not attracted to in the same way anymore. Or it has to do with their own body self-image. Because you might not look as great as you looked when you were 21. And so your opinion of yourself when you want to be intimate, or your opinion about whoever it is you want to be intimate with, or other things that are in your headspace are preventing you from having the experience that you want to have from an intimacy standpoint. And we blame it on the fact that we're having this, like, quote unquote male menopause, when in fact it's all those factors. It could be depression, could be uncontrolled blood pressure that's throwing it off, could be the fact that you and the person that you're attracted to are not seeing things eye to eye. Listen, G, when you're young, you don't need to have your mind in the game.
Nah, you don't care. You don't care. You don't care about none of that. You don't have no problems.
It just works.
Right.
As you mature, things change a little bit.
Right. Right. And I totally get the concept. So it's like, that's perfect. You summed it up perfectly. So I don't know what I just stepped out for a minute.
I have a man cave moment.
I was gonna say, first of all, Dr. Motley, you gotta know that part of the key to the health of a Black man is having other people in the room as a part of the healthcare experience.
Wow.
Okay.
Oh, it's critical. So we know the evidence is overwhelming that if you bring a partner with you to the physician, your health outcomes will be better.
Wow.
Oh, wow.
Because there are many things that
I actually thought you wanted me to read between the lines when you I had somebody else in the room with you to have a better outcome. And I was like, oh, okay.
Oh. Well, Dr. Motley, that's a part of a different conversation.
Right.
I wasn't actually going there. I mean, listen, I'm not going to get myself in trouble on your pod. But what I will say is that in terms of long-term health outcomes for our Black men, it's actually important that they bring their partners
Oh,
to the
wow.
visits
Wow.
because more things are discussed.
Mm.
Lots of things come up people aren't aware of. So, for example, horrible snorers, they have no idea. Oh my God, you did have that one spot on your back. You need to make
Wow.
sure that you take care of that spot.
Yeah.
Right.
There's that thing that's going on that you want to make sure that you take care of as a community, as a family. There's these other concerns that I was really worried about that no one else is bringing up. Those are things that happen when you decide to introduce someone else into the space.
Wow, that is deep. I never heard that, but that's good to know. And we will be making some adjustments to our physical appointments each year.
Oh, absolutely. Listen, and what I say is you don't need to go to all of them.
Yeah.
Just like every once in a while, just go. You're like, I just wanted to come. Just want to see what y'all talk about.
Right.
Just want to make sure that you mention the other thing. Right.
Good. That's really good. That's really good. So just to conclude real quick, can you just give the fellas like a checklist? What screening should they be getting done? Like if they hadn't been to the doctors in a while, what are the like top ones that they need to bring up to their healthcare provider and make sure that they're getting screened for or assessed?
Got it. Blood pressure, super important, super easy to check. Men can check that at home, but you can also get that done in the office. I always say keep an eye on your weight management, not the actual number, but just wanting to be overall healthy is incredibly important. The more weight you carry, the more long-term effects it can have on your health. Increases your risk for diabetes, increase your risk for a number of other disease processes. As you get older, you want to make sure you're checking your sugar levels, right? So, you want to make sure your blood sugar levels are okay. You want to make sure your cholesterol is okay. And those will be things that you check after you get past the ages of 30 to 40. You're going to start checking those on a regular basis. Once we get into the 45 and above, we start talking about colon cancer risk, right? So you're going to start talking about getting that colonoscopy. As you get further than that, we start talking about the prostate. Prostate, especially for Black men, is what I call shared decision-making. There are actually recommendations against men having formal screenings for prostate cancer now because they think the risk of the screening and what we do to people as a result of having positive screens is worse than than the prostate cancer outcomes. For me, I do a lot of shared decision-making with my Black men because Black men are still having worse outcomes than everyone else with respect to prostate cancer.
Yeah.
So even though the recommendations are against, I still talk about, well, let's just make sure you seriously don't want to do this because I think that there could still be some benefit. But that, again, shared decision-making between patient and provider. Other health things, control your alcohol intake. Control your smoking. Ideally, you're not smoking at all. Other recreational things. Be open and honest with your provider about what you're doing. These electronic methods of smoking, all kinds of things. Recreational things like marijuana, gummies, all these kind of things. Your doctor needs to know what you're putting in your body so they can help you to adjust and make decisions based upon that. Other things that I would say in terms of basic other screenings, make sure you stay up on your vaccines. You mentioned COVID. I like to always talk about flu. Those are the two main ones that I try to make sure folks stay on top of. Don't forget to get your tetanus shot. And especially flu and COVID if you got young babies. You don't want your babies getting the flu. You don't want your babies getting COVID if you can help it. So that's kind of a quick snapshot of some of the things that I really think about. Our cancer screens, screening for high blood pressure, thinking about diabetes. And then always making sure that you go with your provider about basic mental health screenings. So are you having a lack of interest in things? Are you finding it hard to connect with friends? Are you having disruptions in your sleep that don't make sense? Has your appetite changed significantly? Those things are also things you want to keep in your mind. Are you finding yourself really having difficulty in terms of really bad anxiety? Those are things that you want to keep on the brain.
So who do they talk to if they do have problems like
absolutely. So you can start with your primary care provider. Your primary care provider. I'm a primary. Like I talk to my patients about all this stuff. I manage depression. I manage anxiety. I manage bipolar. I manage schizophrenia in my office. And if it's really complicated, I will refer out. But my point is that you gotta have. I and most primary care providers have an ability to start all those treatments. So start there. They don't think like, oh, my doctor can't handle it. They can handle it and challenge them to. Like, doc, I really want you to start this here.
Yeah. Or you start to go see somebody who can because your needs have to be met and you deserve for your needs to be met. So this
Absolutely.
was good. Thanks,
Wow.
Dr.
Good
McCrea.
stuff, Dr.
This was
McCrea. You
really
gotta come back, man.
Listen, whenever.
Absolutely.
Listen,
Yeah.
listen. You know, I chop it up on all kinds of stuff. I mean, we don't just have to chop it up about
Yeah.
medicine,
You need a round table, bro.
right?
Yeah.
You know what I mean? Like, you know,
I'm reading
they put you in a lane. You know, it's like,
Right.
oh, he
Men
only talk
only.
about
Too.
men's
Men
health.
only.
You
You need
know?
a men's only room.
Oh, that's
yeah.
definitely we're gonna have to have an executive room. You know,
Yeah.
Dr. Motley just let us know when she's gonna put us into executive session. You know what I mean?
Exactly. Right.
Right? She can't just do the spontaneous. Now we in session.
Right.
Right,
Then
like
she
just
go,
like she did right
"Ah."
now. Like we knew that was coming. Right. See, we knew
We
she
set her
let- she
up.
set us
Right.
up for that one.
Okay. Practicing.
Right. So that way
That's
we'll be
funny.
ready. Nah,
All right,
man,
Dr.
that's
McCrea.
good.
Yep, I'll reach out. I would love to know what other topics you want to talk about. We can definitely set that up. I know we're going to have a lot of fun. This was a lot of fun. I wanted to say really quick, if you missed all the things that Dr. McCrea told you to talk to your doctor about, you can just hit rewind and take it back, pull out your notebook, take some notes, and take that to your next doctor's appointment and make sure that all those things get covered. That's important. That's important. And it's hard to remember all that stuff. So rewind it, pull out your notebook, pull out a phone, take some notes, and be ready when you get ready to make your appointment.
Yeah.
All right. Well, this was a
Appreciate
great
you, Dr.
show.
McCrea.
We
Wow.
appreciate your time. We know you had a busy day. Thank you so much for coming on, and we'll see you next time.
Absolutely.
All right,
It's a
peace out.
pleasure.
All right,
Take care,
Doc.
guys, okay?
All right, y'all take care.
All right, G.
Yes.
Juneteenth was busy, so we got a couple weeks off, which I am grateful for. So we are just going to lay low. I was like, I ain't coming back till after Labor Day. Nobody asked me to do nothing else until after Labor Day, but we're gonna see how that goes.
All right.
We're gonna see how that goes. I don't have any community events to announce right now. So we will check out you all next week, same time, same place. Tune in, keeping it 100 Wednesdays at 12:15.
All right,
See
take care.
y'all then.
Get them checkups.
Yes. I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.